So you can talk through most of it, okay? I'm going to use the paper because I want to be sure I'm not skipping everything that's on here because I don't have 100% memorized. So basically, I'm going to introduce myself. My name's Jerry. I'm going to be a student nurse taking care of you today. I'm going to be doing a head-to-toe assessment today, if that's okay with you. Can you tell me your name and your birthday?
My name is Ryan. My birthday is July 7th, 1985.
Okay, cool. July 7th, so same day. Everybody in my family's birthday's in July except for me. I'm the only one that's not. So anyways, I would do just a general survey. I would say, you know, his nutrition status looks good, his posture looks good. He doesn't have any really, his mood and affect is good, his speech is clear. Just some verbal stuff. You don't have to do everything that's on there, that's fine. And then I'm just going to do a general look at the skin real quick. So if he had shorts on, I would kind of take a look and just see what he has.
Which I have something.
And what do you have?
Vitiligo.
Pardon?
Vitiligo. So I'm two colors.
Oh, okay.
Awesome.
Okay. So I would just, you know, state that. So if the person's got shorts on that you're going to bring, just have them, you know, look at the legs too and the feet and see if you see any lesions, anything like that. The skin looks pretty much intact. I don't really see any breakdown or anything of that sort. Of course, in a real patient, you would look a lot more thorough, right? Mm-hmm. Okay, so I'm going to look at his face, his head. I'm going to palpate his head. I'm going to take a look, make sure there's no bugs crawling around or anything. So, and it looks good. I'm going to have him clench his teeth. I'm going to have him stick his tongue out. Okay, and I'm going to palpate those sinuses. So which ones am I going to palpate first? Does it matter? What am I palpating?
Front.
And his maxillary sinuses, and they look good. There's nothing there that I see.
Oh, that's it?
Then we're going to take a look at his eyes. So I'm going to look at his structures, his eyelashes. I'm also going to look down, see if I see anything, you know, any redness or anything like that. His eyes look pretty clear to me. I don't really see anything there with his eyes. I'm going to see if his pupils are round and reactive to light. And the best way to do this would be to have the lights off, right? But I don't have those, so I'm going to take a look. And they look pretty good. I'm going to look at the looks on the side here. And what else am I going to do? I'm going to do those 6 gazes, right? The cardinal gazes. So can you look straight ahead and follow the pen light for me? Okay. And his extraocular movement is good in his eyes. Isn't that cool? Isn't it scary? So his eyes, there's really no problems there with that. That looks good. I would do the vision test as well, but we'll skip that for some time. And again, you can use the card or you can have the patient. If you're out here, some of you will be in that back room doing your assessment. Some will be here, so wherever you're at, you can use the card or have the, you know, do the eye thing. You don't want me to do that. We all know that, right? 20 feet. Have a read each side and give that thing. Next, I'm going to inspect the external ear, take a look at his ears, and we want to be sure in this checkup, be sure you look at both sides, right? So you want to look at both sides and see if they're okay. His ears look good. We're going to look at the inside. We're going to look at the auricle. And what else are we doing in there? We're going to do a hearing test. We're going to look at the tragus to see if there's anything there. Do you have any problems with your ears or anything?
Nothing.
Okay.
That's a lot of wax.
Yeah, that's normal. That's cool. And then I'm going to whisper something, and when you whisper, you do it from the back so they don't see it. So
I agree.
you're supposed to repeat it, not repeat what I'm saying.
I'll be glad when 9 o'clock's here.
Let's see.
We're all going to fail.
I think you have a problem with your right ear.
Yeah, I do too. And that's all we're going to do for the ear. So now I'm going to inspect the external nose. Can you plug your nose on each side? Are you having any, and do the other side? Are you having any difficulty?
No.
I'm going to look inside his ears and see if I see anything. We don't have Patty here. I don't see any polyps or anything. Patty's got a polyp in her nose.
Yeah.
And we tested the patency for that. I'm going to look at the mouth and so forth. And I have you stick out your tongue.